You've heard about Preservé, you've heard about it a lot, and you've not heard a lot of what is it and how does it really differ from a traditional breast augmentation. And here's the first thing I need to tell you. Preservé is great. Traditional breast augmentation is great. They are both great for the right person. And that's not always interchangeable. So I want to go over exactly what is what and who's the best candidate for each procedure, because let's face it, it's not a one-size-fits-all kind of thing. A lot of it has to do with so many different factors. So let's talk about a traditional breast augmentation so you understand how we've been doing it for years and how we've evolved into this more refined procedure in Preservé. The modern breast augmentation is you want to have a breast implant that most importantly fits the profile of the breast. I think the most important measurement I take in evaluating breast augmentation is what we call the base width. And in general, the idea with a good breast augmentation is you have an implant that matches the base width or the visible outlines of the breast so that whatever implant we put into the body will have a footprint, as we call it, that is the same width as the breast. When you do that, you can then go and put implants of different projections or heights to help you literally dial in how far that implant goes out. Now that does something called biodimensional planning, very fancy term, but basically just saying, hey, when you do an augmentation, you want the implant to fit the person's body. When we do the augmentation, we'll then go into the breast, usually through an incision below the breast, sometimes through the areola. We lift everything up with a minimum of trauma to the body. Okay, so no bleeding. Taking that implant, going underneath the pec muscle, releasing some of the pec muscle as it attaches down to the bottom part of the rib cage here, and creating a nice, beautiful space for your implant to go in that will, again, match that breast beautifully and appropriately. Let it sit for a little while. It generally drops down with time. It settles into the body and creates a natural and lovely breast augmentation. Couple of details and caveats there, okay? First of all, this allows for a scenario where some surgeons will choose to create a very robust augmentation, and that means pushing natural boundaries of the breast. The fact is that there are patients and surgeons out there who prefer a very robust augmentation, so they're going to blow through some natural boundaries. These augmentations become kind of supernatural, if you will. As you do it, you do tend to both respect and, in certain cases, manipulate internal natural anatomy and ligaments. You can achieve a dramatic result, but you do have the downside of potentially stretching things out with the tissue, causing long-term changes in the breast that may be difficult to fix later on. Preservé. What the hell is that? So Preservé is kind of an evolution of thought where we have looked at the internal and structural anatomy of the breast. We found a couple of details of the natural breast anatomy that have been kind of used to get a result that can be very natural, very long-lasting, and I think at its core, very respectful to a person's anatomy. Let's talk about what it is at its core. I think the most important thing to know about Preservé is the sort of understanding of this structure inside the breast called the circummammary ligament. There is literally a ligament inside, underneath the breast tissue that connects the breast tissue down to the pec muscle below that creates a literal circle that defines the breast boundaries, and in all candor is usually kind of blown through in traditional breast augmentations. So what do? We make a tiny little incision here. We insert a device that goes up into the breast circummammary ligament, so it rests on top of the pec muscle, but usually underneath the pec muscle fascia or covering, and it lives. It literally creates a space inside that circummammary ligament. Then, in that little device that's stuck into this area, there's a balloon that pops out. It's kind of cool. The balloon goes into that little circummammary space. It blows up and it expands internally within that ligament circle to create a pocket. And that pocket is a perfect place to put a very subtle, very natural, and appropriately sized breast implant. Now, you can get a sense of where the circummammary ligament is from external markings and anatomy. You can get a sense of what is a good base width and appropriate size for the implant that you want to put. This is something where you say, I have a very specific anatomic field that I'm going to fill. I'm going to expand out. I'm going to pop in an implant through that device that you put in there, and done. So it's a beautiful operation that's super elegant, super simple, and very non-invasive. This is something that also is done with a recovery that is quite simple and is something that respects the anatomy of the breast. When this is done, you will have a result that is subtle. It's actually very targeted into the area of the breast. So who's a good candidate? Who's not? In general, Preservé is used for people who want a subtle breast augmentation. It's not a huge augmentation. It can be done with a mild breast lift at the same time, so that excess breast skin is not going to rule you out. With traditional breast augmentation, on the other hand, you can, of course, do a nice subtle augmentation, but that does allow a little bit more variability in what type of result you can get. You can get some much more dramatic, robust results with a traditional breast augmentation. The other thing you want to look at is, what is the detail? What is the nature of this circummammary ligament? Is this going to give you an augmentation in a place and a look that you want? Because in some cases it may, some cases it may not. So aesthetically, even individually, a person may or may not want a Preservé breast augmentation, may shift more towards a more traditional breast augmentation. My biggest recommendation is, if you're considering breast augmentation, the most important thing is look at the surgeon you're considering. Look at their results. Look at their patient satisfaction. Look at all these other details and use that to guide you first and foremost, rather than just saying, well, this guy does this type of augmentation, that's the most important thing for me. Results matter more than technique. And if you have good, consistent results that are long-term and stable, that's the most important thing. What questions do you have about this? You know what to do. Throw them into the comments. Let's have a good conversation about it.